Ashley, can we get a sound check?
We sure can. Are you able to hear me?
Wonderful. So is it showing recording?
Recording has started.
Yes.
Right.
Ready? Yeah.
So,
We are ready. Okay. Good morning. I'd like to call to order the Board of Health meeting. My name is Ralph Pearson, the Vice Chairman. I wanted to say thank you for Rachel for being the chairman for so many times, so many months to come. So it's all new today. So thanks for everybody for coming. Next would be the roll call. Lois is here, right? Lois, Jeff? Yep. Rachel's here?
yes.
And Ralph's here. We have three people that are not here, right? NK, the new one, that's coming up. So, hey, exciting to have you here.
Thank you.
Okay, I just want to hear ask for approval for the minutes.
So moved.
Second.
I'm sorry, who's that?
Okay, Jeff,
Thank you.
you were here, but yeah, move it forward. All approved? Okay.
Aye.
Aye. Pros? Nope. Okay, good. Any public comments? From anybody in the room here want to make any public comments? There you go. Come on, do you want to come up here or would you like to stay there?
If I may stay here and I'll make sure I speak loudly and clearly. I'm speaking regarding two of the ordinances or amendments that are coming before you today. And one of the reasons that I am here personally and have my name on this resolution is because when I ran and gathered signatures, there were several things that people asked that I please do or look into. And this is one of them. This includes people not only in my district, but I have had several from outside of my district and in this county ask to please take action. I did learn in all of this that Wisconsin is a very unique state because of pecuniary. I apologize. I may be pronouncing. I have not heard the word or several of these words. Just read them. Pecuniary rights of the people to challenge how tax dollars are spent, and that is some of the legal positions that were taken in lawsuits brought forward. And I read very much and learned about stare decisis. I learned about 323.10. I learned about citizen involvement and separation of powers. I absolutely want to clearly state, and please don't misrepresent, this is not an indictment of the previous board, nor any member or staff of Winnebago County, either on the health board or in this building. Please do not misunderstand that. What this is the progression of the ordinance based on case law that does not take away but solidifies the case law through the county, but more specifically the state or throughout the country, but more specifically throughout the state of Wisconsin. And we're just moving Winnebago forward in order with that. This helps clarify an order versus law versus advisory versus the county's course of action. As we all know, science has evolved and there are now lawsuits currently filed against the FDA, CDC, Pfizer, and other manufacturing companies, but that doesn't really apply here. Only that I'm only mentioning because there are dozens of lawsuits throughout the country. Specifically to Wisconsin regarding executive orders that were issued. One case I'm going to mention is Legislature v. Palm. Palm, as you probably know, I'm sure Doug is very well aware, was the Wisconsin Department of Health and Human Services that issued orders in conjunction with the governor and advisory directions to the county. This lawsuit was fast-tracked to the Wisconsin Supreme Court, where it received a 4-3 decision. It is most interesting to note that the majority and the dissent opinions, and I would absolutely encourage everyone to read both. In the dissent opinion, something that I thought was interesting is while they weren't in agreement with the majority, they did say that they would issue a stay regarding these orders. And I think that's very interesting to point out. What was at issue is takeaways from this lawsuit regarding clarification of structural delegation. The court specifically called out State Chapter 252. It's stated under 252.03 and then 3, 4, and 6 that the powers of those in Chapter 227 state that rulemaking power can only be exercised through adequate procedural safeguards, and rulemaking must involve public participation through a legislative process. Most notable to point out is not only did this dissent clearly say that stay would be issued, but the Evers administration could have very easily appealed or asked for action in the legislature, and they did not. In Favik v. Evers, the case also called into question the response. Specifically named was Executive Order 105. This was about multiple emergencies based on the same or similar conditions that were declared invalid or unlawful. I would absolutely encourage everyone to read some narrative from Von Briesen. To be fair, it's 60 pages, and I'm not going to recap that here. There was also a subsequent from the Von Briesen law firm on this on October 14th of 2020. That one's only 6 pages that you might be interested in. You can find those links through the WCA website. Again, this decision was a 4-3 decision, and the justices referred to a lot of case law through the Supreme Court of the United States, as well as the previous rulings in the state of Wisconsin. There is James V. Heinrich. Heinrich was the public health officer. That specifically went off of Andrea Palm's orders and the executive orders. And it was determined that it was detrimental to school children. And we have all seen the data of what's happened to children regarding drug use, depression, the lack of speech development in some of the younger people, or the younger students. And the court agreed that stating the schools are not the same as considered public gatherings. Thought that was a very interesting part of the ruling. There are other lawsuits. Something that people very often go back to is what is known as the Jacobson ruling, which I believe was the early 1900s. And the court determined the Jacobson ruling does not apply in this case. There's also Tavern League of Wisconsin v. Palm. That was also a 4-3 decision that talks about the ability to limit gatherings. I could go on for hours. I have easily combed through over 3,000 pages and watched 100 hours on YouTube, Wisconsin Eye, and people talking on YouTube about all of these cases. I understand for you and for the county board, this is not going to be an easy decision. Again, I want to clearly state this does not take away or remove authority or advisories from the health department in Winnebago County. What it does is, going back to the ruling of Legislature v. Palm, is that it asks the board to come back and reconsider it more often. Again, do not take this as an indictment of our health department. This is not an indictment of the county executive or anyone in this building. This is only a progression. It is not a repealing of 1108. It is amending 1108 to keep up with case law involving public involvement. Thank you very much for your time.
Thank you. And being new, I forgot to say your name. I have to have your name and your address,
My
please.
name is Conley Hanson. I am Supervisor District 26 and a co-sponsor of the 2 resolutions that are coming before you today.
Appreciate that. And the only other thing that we probably should have is that I'm going to try to keep it to 4 to 5 minutes.
Did I go longer?
No, you're fine. I wasn't timing. I never beat her, but I just wanted to make sure you know that. And if there's time, we can go a little longer because it's a very interesting topic that we should talk about. So thank you. Is there anybody else in the room that'd like to speak? Is there anyone else? Is there anyone on Zoom that'd like to speak? Is there anyone else on Zoom that'd like to speak? Last chime, is there anyone else on Zoom that'd like to speak?
We might need to give them a minute.
Oh,
This is a new platform
Gotcha.
and they may not know how to raise their hand or.
We're just on a new system, so I just wanted to check, make sure we didn't miss anybody. that
You have an option to click raise your hand
Okay.
on the top of the screen.
Okay.
Somebody unmuted themselves. If you'd like to speak, you can go ahead. Okay.
We need to ask if she wants to speak.
JJBdoc@charter.net. Would you like to say something during public comment?
I guess. It's also fair. All right,
No, maybe.
stay. All right, now, more public, so now we're on to business. And the first point of business is to welcome Kay Haran, Supervisor Haran, to our board, so appreciate you, glad to have you.
And I would like to say thank you, Doug, for yesterday. It was really informative. I went home and I went, oh, thank goodness I'm home. It was a full day.
Good, well, we're glad to have you, okay?
Thank you all.
Now, our next point is to elect a new Board of Health. Our chairman, I should say, thanks to Rachel, she's going on to some other stuff, but she'll still be staying on helping us, so do we have any nominations? For chairman,
Ralph Harrison?
I'll second.
anyone else? All in favor? Aye. Yes, thank you, appreciate it. I hope I can do half as good as you did, so how's that, okay? Well, next thing I think we have to do, because I was the vice chairman, so we have to elect a vice chairman. And Josh had told me, he sent me a note that he'd like to be vice chairman, or like to be nominated. And I think you can nominate him if he's not here, but Josh wanted to be vice chairman, so that's just one. I want to make Josh feel.
So I have a question. That's not on the agenda.
So. It automatically it's on because of change of office.
If you look, it does say elect a new Board of Health chairperson. This is a vice chairperson. So I think that's fine. Okay, just think it's fine. It's there. Right, second the nomination for Josh.
Second for Josh. All in favor? Aye. Opposed? All right, welcome, Josh. Okay, next is C, an ordinance amendment, 11084, definitions for individual and general orders. What, who's gonna, which one of the three want to come up? Okay.
Probably.
Us up here.
I don't get a spot up there.
We can pick a spot for you.
Move in.
Could you just state your name?
Sure. Brian Defferting, Supervisor for District 6 inside the city of Neenah. And thank you everyone for considering this ordinance proposal that's in front of you today for the Board of Health. The history on this, I mean, I don't really need to, I don't think I really need to go through the history on this. I think a lot of people know about the history on this. There was a lot of consternation within Winnebago County in regards to this particular ordinance that was passed in 2020. And there still is a lot of niggling concern from our constituents, our residents in Winnebago County. And specifically in regards to individual orders. If you look at the current verbiage of it, it does state that any health order under this ordinance applicable to a specific person, a group of persons, or gathering spot. And a lot of people had a lot of the concerns that we had from our constituents, from especially from those that I speak with in my neighborhood. They were very concerned that these individual orders could possibly apply to any type of public gathering. And that could apply to, it could be like a public protest, maybe at the sundial, or perhaps gathering for mass for religious reasons for church. And so this, upon research and lots of research too, and I want to thank Corporation Counsel for a lot of her education on this, because I had to go through the rabbit hole too of legalese. I'm not a lawyer myself, although my dad is one. And so upon looking at what it was for individual orders and what per previous rulings of the Wisconsin State Supreme Court, because there's been numerous rulings on this over the last couple of years, that there is still the public health officer does have the power to quarantine for certain types of communicable diseases, whether they do name tuberculosis in the state statutes as one example. Hepatitis B, I believe, is another example. And so we wanted to make sure that we're not impinging upon the people's right to free assembly. That's the key thing here, is that obviously we have concern for public health, but we also don't want to impinge people's right to free assembly. And so this particular ordinance takes that language, group of persons or gathering spot, and just moves it to general order. Because that's where I feel it belongs, and that's where my constituents feel that it belongs. So that way, if that, just in case, that this is kind of more like future-proofing ourselves, we are constantly looking at the language, or constantly amending the language and making sure that that we're still protecting our civil liberties. And so that's where this ordinance comes into play, is just taking that language and moving it to the general orders part of it. So that this then follows state statutes in regards to individual orders, whether that be quarantine of some sort. And so it just seems to be more in line with it, be congruent with it. So that's the heart of this, is that the ethos behind this is to make sure that we're not impinging upon people's civil liberties.
We talk about the first one, or you want to talk both of them together, or should we do?
If you.
Are you here anyway, and then we can discuss it?
Sure, I mean, it's up to you, whatever the board would prefer, we could talk about the other one as well.
Want to talk both of them again?
I think,
Individually. Oh, I'm sorry, behind, sorry.
I was just thinking it might be clearer if you do take one up individually.
Okay, I agree. Okay, agreed? Okay, cool. All right, so any discussion here? Anybody have any questions? Thoughts?
well, I want to see.
Okay.
I would just say if we're keeping current with the current law, this makes sense to me.
I have a question, like, how does this change anything? Like, if we had a breakout of tuberculosis, you can still, right, like, it doesn't really change. What's the difference between an individual order and general order? Well, if Doug gave it.
Don't answer that. So tuberculosis may not be the best example here because the communicable disease statute specifically addresses tuberculosis separate from other communicable diseases. And so an example, so I could just use one that's going on right now, measles, right? So we've had cases of measles in Wisconsin and Illinois. Measles is a highly contagious disease. It's vaccine preventable. 9 out of 10 people that aren't vaccinated are likely to become infected. And a quarter of those people that are infected are likely to end up in a hospital. And so there's an extremely intensive response going on down in the southeast part of the state right now in order to try to limit the spread of measles in our population. And so in a case where, we have identified someone with a disease that is likely to spread and or impact others, we are going to work with that individual to find the source of that disease, find out who they've been in contact with, and try to limit the spread of that disease. Typically, that process goes fairly smoothly. Most people don't want to spread the disease, and are voluntarily compliant. On occasion, someone may not have regard for that. And in order to protect the community or the public, we would have to issue an order to isolate someone that's been exposed to a disease, or to quarantine someone who's been exposed to a disease, or isolate someone who actually has disease and can impact others. That is really the most typical situation in a single case. Now, let's say, in terms of group of persons or gathering spot, in the case of, say, measles, we might have a group of persons that have been exposed to measles. And that group of persons, some of those individuals may develop disease and then spread it to others. In that case, we would be looking for, voluntary isolation for the period of, that disease that may develop and be communicable to others, so as not to allow spread. And so that's a case where, let's say someone was in a meeting, one of us, for instance, is in a meeting, we have measles, or we aren't exhibiting symptoms yet, but we're contagious to others. And there's unvaccinated people, we're gonna let everyone know that they've been exposed to measles and ask them to quarantine themselves. If they're not willing to quarantine themselves, then we may issue an order if that's most appropriate in order to protect the public. And so that's, that would be a single disease instance for a group of persons. A gathering spot, may come into effect when, a place or a location is the source of disease. And an example of that isn't super uncommon is a disease caused from, a bacteria like Legionella, where, a cooling tower, is spreading bacteria that's infecting people that work there, or metalworking fluids has Legionella bacteria in it, it's infecting workers at a plant. That's a place where, in order to protect the workers that are there, we would ask for voluntary compliance, of course. But if that voluntary compliance didn't occur and we want to prevent that disease from, occurring in a large group of workers or at a place where that bacteria is harbored, then we would potentially issue an order to, to correct that condition, to cease operation, to keep people away, whatever is unique to that particular situation. And so if we're not able to issue an order, if necessary, and again, it's pretty rare that we actually have to do that, then we are not able to react and work to prevent disease in a timely manner. Because the second resolution, of course, is about, it's only advisory unless the board approves, and there's no provision in that for the board to even take it up. And so if we needed to issue an order to prevent disease at a location, we wouldn't have the authority to do that.
But this one doesn't stop you from, like the one with the first one, that doesn't stop you.
This changes the definition and it makes it a group of persons or a gathering spot, a general order. And the general order is handled differently than an individual order is the point.
Okay,
And so in code, an individual order is considered to be a person, group of persons, or gathering spot. And that's really a category unto itself versus a general order. So we would be redefining that as kind of currently laid out and interpreted, in state code. Sorry, Rose.
Yeah, I'm wondering about the difference between the individual and the general order in terms of how effective it allows the order to be and how effective it is at suppressing that disease. Am I saying something wrong? Oh, you kept raising your hand?
Do you want, is it okay if she gets in? You, Marianne, do you want to make a comment about the legal
Sure,
part?
just tell you the difference between a general order and an individual order. And let me just sort of go back to sort of give everybody an overview, although I'm sure a lot of you know what has occurred over the last few years. But basically, after the Supreme Court decision